Can you take us through your journey, say in a 5 year blocks, like, what are those geographies you worked and what are those domains? And actually, like, I would like to give you examples so that, my neighbor or the non-development person also understand, okay, so this is the work actually when we say development sector, sir. Please, sir.
So, if I have to divide this whole journey and give highlight into different time zone, I would say, but before that, say that I'm one of the rarest luckiest person. I would say that being called consider myself a mixture of both public health and hospital health systems management. So, having worked in almost every part of this health system spectrum, I've worked as a health facility management manager. I've been the trainer, teacher, research, consulting, worked with the union organization, worked with the national organization, um, hospitals, So and in almost, I started one of my career started from Bangalore, went to Belgaum, went to Bombay, Jaipur, UP, then to Bihar and now Orissa. And in this part, having worked in different countries, so I've been exposed myself to different part of the country and neighboring place. So if I define, so I just want to say that lucky that I have almost every part of the geographical part of the work in different geographical part of the country and other part. So if I define, I think I can divide into three part. One is early phases, first 5 6 years where I began as a health system manager. So I worked in hospital, tried to learn, and other agencies like public health agencies where I tried to learn the nuances of information need, real need in the ground field, challenges people face. No, that time healthcare facilities was there, but there were no concept of doing costing. So people used to provide the services, but they don't know what is the cost. So the rates had no linkage with the price. And I'm talking about the trust run hospitals, where they charge very minimal amount. So even, and then I realized that even for a trust and hospital, if you don't know your cost, your bottom line, how, and you charge irrationally, then probably you are not able to meet out even your expenditure. So how would you sustain in the life, and how you do aim? Because aim of the NGO is what? To generate at least that much money so that they can sustain and provide the care or service delivery in long run. So in the beginning, of course, I learned about the project management, costing, the services, the challenges about the uh, in the health system, and of course building the skill around that. Then I moved to IHMR, where I worked as a faculty, and IHMR, I said that it is my alma mater. So there, I think the most of my learning and relearning came from, again, from IHMR, where I was involved in not only training, teaching, research. So I would have trained more than about 300 400 people of different cadre of the healthcare, right from ANM, ASHA workers to the IS officers and the medical college principals, deans, professionals, and of course more than 1,000 students I would have trained. So in that part, really gave me a lot of kind of opportunity to generate the evidences about the real problem in different part of the country. Like as I said, I was part of the NFHS, GATS. Uh, was able to train in the different part of the country in different spaces like quality improvement, HMIS. You remember, I think you were there in one of the project where we tried to work on strengthening the health information system in Uttar Pradesh, in Bihar, which was funded by UNFPA. So where our main aim was that through HMIS, if we can improve the decision making so that service delivery improves. And I think we can talk sometimes, if not today, how really that helped. And because whenever I go to Bihar, I meet my counterparts in public health and in the state, and the people still realize and remember the contribution we made during that part. And of course, later on, when I left IHMR, I would say that I've been mainly involved through my leadership interventions where we could create some ripple effect, to create some real sense, like working with WHO, World Bank, and different organizations where we could do the capacity building of different organizations. We could really improve the quality of government hospitals. Like I was part of the project in World Bank where we did improvement of quality using NABH thing. So that was, working for a private sector, going for NABH is one thing, but working with the government sector and improving the quality in that system, I think is the real satisfaction and real satisfier, because there are lack of resources, there are a lot of challenges, and if we could do the thing, and the most satisfying part is that even if we leave the organization, those systems are still continuing. So that means at least there was some sense of achievement, that we could really do something which is still there, and because of that things are continuing in the ground level.
Okay.